Was it? Okay. Oh, there's lots of toys behind me. All right. We'll wait for people to join. I like your mask.
Thank you.
Thanks. How are you? All right. Well, we are going to have a good vaccine discussion today. Are you excited?
So excited.
We're very excited.
I forgot the plastic divider, so we're wearing masks, so you can't tell who's talking.
Yes.
But if anyone says something smart, it's me.
And if it's funny, it's me. Just kidding. We're actually going to practice being ventriloquists today, so it's going to be great. I will now puppet Destiny. All right. It looks like people are joining us, so thank you guys. We know it's the middle of the day, but these days it's kind of hard to find a good time to get together and spend some quality time together on Facebook Live. But today we're going to talk about vaccines because it is a very exciting time. We have the new COVID-19 vaccines, and we are here to answer all of your questions. So Destiny is going to kind of we'll watch for questions. Go ahead and put them on there. Thank you, guys. We also know people like my sister-in-law. Apparently, she's not actually working right now, so she's on Facebook. Just kidding, Erica. All right, so we'll answer any questions that you guys have, but we're going to start off kind of just with a rundown. So hopefully, we'll answer your questions even before we have to ask them. We have a plethora of knowledge.
So much knowledge.
So much knowledge. All right. Okay, you want me to start off?
Yeah.
Or do you want to start off?
You talk about the nerdery, and
Okay.
then I'll talk about distribution.
We know our roles in this. I'm definitely the worst nerd. Okay, so just to start off, we have the first two of the COVID-19 vaccines, the Pfizer and the Moderna vaccines, right? Both of the vaccines are FDA approved for emergency use authorization. And so they have gone through all the safety protocols. They've gone through all the stages of vaccines in order to get them to the point where they are safe for us to be distributing and administering to people. So that's one of the biggest things that we really want to stress today is that we do believe that these vaccines are safe. And we'll explain why, because we know that there's a lot of questions about them. So, we have already been distributing the Pfizer vaccine here in Wilson County, which is very exciting. So our healthcare workers were our first ones to start getting vaccinated, and then we're going to continue on, and Destiny's going to talk more about that. But what I want to talk about first is how the vaccines work, because one of the biggest concerns is, well, are they safe? I mean, this was so fast. How did we produce these vaccines? Because prior to these vaccines, the minimum amount of time that it's taken to make a vaccine was 4 years. And that was for the MMR vaccine, I believe. Mm-hmm. And so this one, it was produced in a year, or less. So the important part about this is that it uses mRNA technology, messenger RNA technology. And that technology has actually been studied since 2003 when the SARS virus was out, and we thought it was going to be a much bigger deal. And so they've been really trying to produce this type of vaccine for a very long time. They even did studies on humans. They didn't get through the entire vaccine trials because SARS didn't end up being a big thing. But they did human trials on mRNA vaccines back in 2013. And so this is not new. They didn't just pull it out of nowhere and start using these vaccines. So mRNA technology has been around a while, but these are the first vaccines that use mRNA technology. So now we get to talk about what mRNA technology means, right? So we have messenger RNA in our body already, right? So we produce them, these little messenger guys. What we're doing in the vaccine is they take messenger RNA and they put it in a little lipid bubble, so a little fatty bubble, so that it can get into our body, because mRNA is very fragile. It's just going to disintegrate, as soon as it makes contact with like the air or whatever. So that's why we have to protect it and get it injected into the body. So then when it gets delivered into the body, it goes to the cells, and the cells take that messenger RNA, and all that messenger RNA is like instructions or blueprints. And then the cell says, let me see what to do with these instructions. I guess I'm supposed to make this spike protein. And so it makes this spike protein that looks similar to the one that's on the COVID-19 virus. And you've probably seen those pictures where it's got the little angry red spikes on it. So our body then starts producing these little spike proteins. And then the mRNA just goes away. Like it gets broken down because we don't need it anymore. The cell has done with it what it needs and it goes away. And that's an important piece too, because people say, well, is it going to stick around and alter our DNA? It doesn't even interact with our DNA. It doesn't have anything to do with our DNA. It goes away. It's not hanging out to do anything else. So we have these new spike proteins that we just made. The cell is super proud of making its own spike proteins. And then it delivers them out into the rest of the body. And now the body is like, what is this? We don't like these spike proteins. They're not normal. They're a foreign substance. So what do we do with them? Well, like all foreign substances that get into our body, viruses, bacteria, all that, our immune system starts gobbling them up. And so in doing so, they start to say, okay, every time we see these spike proteins, we're going to attack them, or we're not going to let them do their thing from the very beginning. And so they start creating these antibodies. They have memory. They have the ability to attack these spike proteins as soon as they show up and protect against them if we come into contact with them. So that's how the mRNA technology works. The mRNA is just the instructions that get into the cell that tell us how to make these spike proteins that get gobbled up by our immune system that then protect us against COVID. And so that's the start of the nerdery, right? So we'll kind of move on because we wanted to touch base on how it works, why we were able to develop them so quickly, and now we're going to talk a little bit more about the distribution and administration of the vaccines themselves.
Yeah, so it's my turn.
Yay!
The KDHE is distributing all of the CDC and KDHE are distributing all of this vaccine free of cost to people. It started, like Jen said, we got the Pfizer vaccine in the hospitals. Those were specifically for hospitals and frontline workers that are working with COVID-19 patients. And that is our first priority as far as the tiers go on distribution. So the health department is getting vaccine, and we will be helping to vaccinate home health workers, pharmacy personnel that are, helping with sick people, ourselves, public health, anyone who comes in contact with anyone who has COVID-19 in a clinical setting. So that's the first priority, that and long-term care. I know our long-term care people are really, really ready to see their families, and their families are ready to see them. And this is just one huge step closer to that. So they are all contracted out of county with big pharmacies. That was something that the state set up as a contract. So I think all 3 of Wilson County's long-term care homes are contracted with Walgreens. So Walgreens is going to come in and vaccinate everybody. How this vaccine, there's 2 vaccines, like Jen said. The Pfizer vaccine, I don't know which one the pharmacies will be bringing, but when you get 1 dose of the Pfizer vaccine, and then 3 weeks, 3 weeks later, you get a second dose, 21 days. And then the Moderna vaccine, which is what health departments are going to be getting, you get 1 dose, and then 28 days later, you get a second dose. So just getting the first vaccine does not make you fully inoculated against the virus. We know that it takes a week or 10 days for the first shot to become effective, and they're around 50%, around 50% effective. So that means, it's more of a 50-50 chance if you come into contact with COVID that you will get it. And then the second dose, 28 days later, or 21, depending on what vaccine you get, is another 7 to 10 days before it's fully effective. They're very, very effective. They're somewhere between 90 and 97% effective. So we, even if we started vaccinating today, we wouldn't have a good immunity for a month. Or month and a half, 6 weeks. So we want to just make sure that everyone's aware. We want people to keep wearing masks after their first dose, just because, you are not fully immunized until you get 6 weeks past the second dose. And even then, we're probably still going to be telling you to wear masks, just because we're not sure if you can get it and transmit it. We're not sure of that yet. So anyway, that was a tangent. Sorry.
And I do think that's important because a lot of people have asked, are we going to have to keep wearing masks? Well, the answer is yes for now. Our hope in the end is that no, like eventually when we have enough people vaccinated, that we won't have to wear masks anymore and we can get back to actual normal life. And this is really our biggest hope of being able to do that, because we need to get to that herd immunity level. And we've talked about herd immunity and how, we don't want to try to get to herd immunity just by everyone getting sick, because too many people will die. And we are already seeing that. But we can get to herd immunity safely with a vaccine. And then that's when we will end up hopefully not having to wear masks. In the meantime, though, we don't know if we'll be able to transmit it asymptomatically, even if we are fully vaccinated. And we also know that there are a lot of other respiratory viruses out there right now, and our hospitals are full. So let's try to prevent each other from getting flu and RSV and all the other things that we normally would see this time of year that might take up some of those hospital beds. So that's why we'll continue to use these other measures. We know that vaccines are part of the solution, but they're not the whole solution at this time. So
yeah. So the next step after we're done with these frontline healthcare workers moves to your critical infrastructure people like police, fire,
teachers, I believe.
Teachers, school staff. And then they start rolling in some of the really high risk people, maybe group living situations where they're not necessarily long-term care, but they are in group living, which makes them more susceptible to spreading the virus to one another. And then it just kind of trickles down to less and less and less risk factors from there. So I did see a question from Eric that said, are we worried about giving all of the healthcare workers the vaccine at the same time? He just worries that they're going to get it all at once without knowing the side effects. So this vaccine, it's been given to, it was tested on 70,000 people with very few side effects. There is some contraindication for anaphylaxis. If you have an allergy to, anaphylaxis is when you have an allergic reaction and your throat swells shut.
Like a very severe, where you can't breathe, you need epinephrine, that kind of thing. Not just a rash or anything else like that.
Yeah, like a severe allergic reaction where you can't breathe.
And even in those people, out of the 70,000, we've seen 2 of those, reactions, those anaphylactic reactions. And we don't know if it had to do with the vaccine. And those people had previous anaphylactic reactions. But we also know that you can safely get the vaccine even if you've had that reaction before. We just want you to have your EpiPen available just in case. We have one example in Wilson County of someone who did that and has had the vaccine and did have multiple anaphylactic reactions to other things in the past and did great. So I think that's something that's very encouraging. So it's not an absolute oh, no, you can't get it. It's, hey, let's just make sure we're fully prepared also.
Yeah, and I mean, for full disclosure, the health department has epinephrine with them every single time we give a vaccination because it's a chance anytime. And it's just something that is I don't want to say it's not common, but it's always a risk.
A possibility.
Yeah, when you're getting vaccines.
And so that's a low number with this.
Yeah, we have never given epinephrine at the health department since I've been there.
All right. We give it all the time just for fun. Just kidding, not really. Makes y'all feel weird and jittery. So Eric, kind of tagging on to that, we did get vaccinated. I got vaccinated last Wednesday, and the worst thing that happened was my arm was really sore. Now, I'm a super, super tough person. Just kidding, I'm not. I'm a wuss. And the shot hurt less than the flu shot, quite honestly. And then I didn't feel anything else except for, and the people in my office didn't feel anything else except for a sore arm. And so that was really encouraging. We also know through those trials of the people in Pfizer and Moderna, both those 70,000 people, pretty much all of the reactions that did happened within the first 2 days of the vaccine. It's going to be injection site tenderness, like soreness in your arm, fatigue, fever, body aches, chills, that kind of stuff. And pretty much, and I say pretty much because I'd like to say all, but I really think, really like 99% of it was mild to moderate. There were no severe reactions. And historically, with vaccines, we know that the vast majority of those side effects happen in the first month. And in fact, people who are in these studies for Pfizer and Moderna were studied for 2 months just to make sure, And so we're not expecting long-term effects from this. We don't know what the future holds, and if we have to weigh it out, the unknown of an effect from a vaccine 10 years down the road versus knowing that COVID itself has already shown long-term effects, in the year that we've been dealing with it. We try to always weigh out the benefits and risks. And what we're seeing is the benefit of the COVID vaccine and the possibility of long-term effects really, to me anyways, and I'm just sharing this, outweighs the known long-term effects of COVID. So that's just something to think. And really, I think people are tolerating this vaccine very well.
Is that called sterilization immunity when you're both immune and unable to transmit?
Aaron, that's a good question. I don't know that answer, but we can definitely find out. So thank you. He asked about sterilization immunity, and if anyone else on here knows, then
I've seen several doctors pop up.
Yeah. So if
anyone has an answer, that's great.
Yeah. I saw Megan mentioned, do you think the reason why we are not seeing so many cases of the flu is because we're wearing masks? And yeah, I really do think that we're, usually this time of year we'd be seeing flu. I haven't seen any flu. We'd be starting to.
Yeah. Really heavy flu season's generally around February, so we're still early in flu season, but it could hurt.
It definitely would help to wear the mask. So yes, I really think that we're going to see multiple benefits from the masks in this time when we already have COVID and we have flu and we have RSV and we have rhinovirus and all those things. Let's not get sick if we don't have to.
Mm-hmm. For the few that had severe allergic reactions, do we know what they were allergic to prior to the vaccine?
No, Kevin, on that one, he asked, for people who had severe allergic reactions, did we know what they were allergic to prior? We don't. And technically you could have an anaphylactic reaction to something environmental, maybe a bee sting, maybe a food or a medication. So it really could be any of those things. But we do want to make sure that people know if you've had like an allergic reaction to something, that doesn't mean that you can't take this vaccine. Even if you've had bad reactions, like every time, you're around Destiny or something, like you break out into hives, but you can still get your vaccine. I'm getting hivey now anyways.
What time frame for the majority of us to receive one of the multiple vaccines to approach herd immunity? So herd immunity we're 70%, 75%?
We're saying we don't know, but we're saying 70%, the CDC and all them.
Yeah. So that's 70%. So if we were to reach 70%, I'm thinking they're saying that for the general public, vaccine should be, oh, sorry, Eric. The vaccine should be available for the general public in spring, say April-ish. So you get the first one in April, you get the second one at the end of May. So it could be as early as June, depending on the allotments and who wants to take it. And that's the whole thing. It's optional. It's not going to be mandated that you get this vaccine. It's just like not any other vaccine, but the flu vaccine or anything like that, you don't have to have it. So,
now, technically, like an employer, in theory, yes, an employer could mandate it.
Could, yeah.
But we're not seeing that at this point.
Right. And schools mandate specific vaccines for students to keep all of the students safe. So county-wise, government-wise, it's not going to be mandated that you get it, but your employer could require it. Mm-hmm. And if that happens, I guess you still have a choice. You don't have to work there, I guess.
Yeah, it is really like a discussion to have. So.
Yeah. So, so I would think, the thing is, to reach herd immunity, 70% of people have to get the vaccine for us to reach herd immunity, whether we have a vaccine or not. So, 15% of the county getting it isn't going to get us herd immunity. I just want to be really clear about that.
And of course, everybody doesn't have to get it at once, and that probably won't happen because we still are getting allotments, like Destiny said, of vaccine. And so we hope to gradually get there. We would love for everybody to just want to get vaccinated right off the bat as soon as possible. But the reason we're even doing this today is because we want you all to feel comfortable. Like, we don't want you to feel like take the vaccine because we said so. Like, we want you to know everything there is to know about the vaccine, the science behind it, the reasonings, the answers to questions, because there's a lot of misinformation out there. We want you to feel good about what you're doing, and not feel like it's something that you're kind of blindly going into. And that's why we want you to answer these questions, or ask these questions about vaccines, so we can help out with that.
And Chuck, you asked if there was a difference between the Moderna and the Pfizer vaccine. It is the same technology. One is a super cold frozen vaccine. The other one's just a frozen vaccine. The technology is the same.
And the reason that they have to be super, super cold, stored in a negative 90 something degrees freezer, the reason is because they don't use any preservatives, which I think is an important thing too, because preservatives kind of got a bad rap, right, for vaccines. So these vaccines do not have any preservatives. Now, Chuck, with your question also, the AstraZeneca vaccine that has not been approved yet, that is made more like the flu. So it is more like where they take the killed virus and take a part of it and then create the vaccine from that. And one thing I didn't mention while we were talking about the development of the vaccine, that's how vaccines were made before, is because they had to grow the virus first, and then they had to take that virus, kill it, break it into tiny bits to turn into the vaccine. Well, we didn't have to grow anything. They didn't have to grow anything here, and so that's a big part of it as well. So they don't use eggs, so there's no egg allergy contraindication here. They just produced it synthetically, that mRNA, so it didn't have anything to do with growing things. And I am going to point out that because of that, it's a very easy question to answer about people saying, is it true that there were fetal cells that were used in the making of these vaccines? The answer is no, there were not, because there were no cell lines used anyways to make these vaccines. A long time ago, for full disclosure, there were vaccines that were studied using fetal cells from fetuses that were aborted for whatever reason, not for science, but they were. And so those were they were able to take fetal cells anyways from them and then use those for developing vaccines, studying vaccines, and all that. That was in the 60s. And I'm not saying that's okay. I'm not saying it's not okay or whatever. I'm just saying that was a long time ago, and we can see where people would hear this and be concerned about that. But in this case, it's not even a thing. So no cell lines here.
Yeah. And Kevin Mosley also points out that a lot more people got the flu vaccine this year, so that could be a reason for the lower numbers, which is a good point.
Heather Howland mentions that she has an EpiPen for bee stings, and she took the vaccine and did great with it.
Yep. Larry, we don't know if you will need a yearly booster shot at this point. It hasn't been long enough. But so far, it's looking like the antibodies that stick with you for a long time, there are two different kinds of antibodies. One is right off the bat, you get it in a couple of weeks, and the other one is the one that lasts a long time. Like when you get an MMR vaccine, those antibodies last a long time. So they're seeing those types of antibodies. So the hope is that we don't, but we aren't sure yet.
So, and if we do need boosters, it will be similar to what you would see with a tetanus shot, or a yearly vaccine like you would see with the flu. But yeah, we're hopeful that this 2-shot series will be all we need.
I was diagnosed with COVID in October. I had a moderate case with many
signs and symptoms
lasting 7 full days, although we're not sure yet.
Of course.
Dogs.
Okay.
The question is, should she wait the 90 days to get the vaccine? And if so, if they do get the vaccine, can the reaction be more severe?
Oh, Gotcha. You want me to answer that?
Yeah, go
Okay. So that is a good question. People ask, like, if I've had COVID, do I need to get the vaccine? Yes, it's just for exactly what Destiny said, that we're seeing from the vaccine that we're having more of that long-lasting immunity versus, yes, Diane, if it's not my cat, it's my dogs. Oh my gosh, my animals hate me. If we're seeing more long-lasting immunity from the vaccine than we are from the actual infection itself, our natural immunity. And so, but we do, because we know that we only have a certain amount of vaccine available, we do recommend that people who have had COVID already wait the 90 days so we can prioritize other people who don't have any immunity whatsoever. And so we can, but you can get it. Let's say you had COVID, 2 weeks ago, you could get the vaccine today. And
as long as you're well.
As long as you're well, yeah, and still be fine. If you got the vaccine and you found out you had COVID tomorrow, still, you're not going to be, it's not going to be a bad thing. It's just, we probably wouldn't have vaccinated you if we knew that. But we just prioritize because we want to get those limited numbers of vaccines out to the people that might need it. You asked if there was a possibility of a worse reaction if you've already had it. I actually don't know. That's a great question, because you already have some antibodies. Is your body going to kind of react more strongly to the vaccine? It's a great question, and we can definitely find out about that. But it's a good thought.
Yeah, and
how about the second? Yeah, are you going to say that one?
Stephanie?
Oh, no. Like how people get worse reactions with the second
Oh,
shot.
yeah. So it is a 2-dose vaccine. So we know that after you get the first dose, your body does have an immune response and build those antibodies. With many vaccines where there are more than one in the series, so like hepatitis A, hepatitis B, MMR, tetanus is a really good example. Nearly everyone has had a tetanus shot, and when you get a tetanus shot, it hurts, right? It's a really sore shot, and that's because your body knows what to do with tetanus. So you get a tetanus shot in your arm, your immune system ramps up, and it just attacks that injection site because it knows exactly what to do. So that's why when you get a tetanus shot, sometimes you have a knot there, you have a fever, your arm is sore. That is your immune system kicking tetanus's butt. So and the more tetanus shots you get, the more sore your arm is going to be. So it could be that you have more side effects the second time, the second vaccine, because your body is just all geared up for it. It's just ready. So it'll attack it harder. So that's a lot of times what the side effects come from, the body aches and the fever and stuff like that. That's your immune system doing its job. It's not a bad side effect. It's actually a good reaction. It's just a little bit painful and uncomfortable.
And it is physically impossible, like scientifically impossible, to get COVID from the vaccine since we're not using any part of the virus. Just want to throw that out. Yeah, I think so.
And Stephanie, you asked if it was safe for breastfeeding mothers. There is not a contraindication, which means it's safe, or there's no reason not to give it to a breastfeeding mother. There's no reason not to give it to a pregnant woman. It's
So,
not a live vaccine. So.
The American College of Obstetricians and Gynecologists actually do recommend the vaccine for pregnant women and lactating women. We understand, though, asking, especially if you're pregnant, asking those questions, because again, we want you to feel comfortable. And obviously, like, we don't have 70,000 pregnant women that they tested on, but we'll get more information as we go along too. So, but lactating actually seems to be a very safe time to get the vaccine too. Anybody lactating, I mean, if we're just, I don't want to discriminate.
Yeah, anyone.
Anyone back.
What allergies cause?
Did you all say what allergies are caused for not taking the vaccines? Appeared to me the ingredients were slightly different. So, Michael, there are no specific things that say, like, if I'm allergic to X, don't get the vaccine. So there's not a single thing out there. The only thing that we say is, or that's been said, is that if you've had like a severe anaphylactic reaction in the past, then at least have your EpiPen available, but talk to your doctor about whether you can safely get the vaccine or not. But we are seeing that that people are doing well with it, even if they've had anaphylactic reactions in the past. But not like flu or whatever, where it's like, oh, if you've had an egg allergy, then I can't do this, So there's nothing like that here.
Right. Do we know if COVID antibodies are passed through breast milk?
Janae, I'm not sure on that one. But you would think, because we do pass on a lot of our antibodies in breast milk, and so hopefully that would be the case, that we would see some sort of protection there for nursing babies. So great question, and again, we're always happy to find out, and we will never make stuff up. we'll tell you what we know and tell you exactly what we don't know. So let's see. So some of the other things, and I've kind of asked, we've asked around, like, what kinds of questions do people have and what has come up the most. We know that people kind of might have some mistrust of government or pharmaceutical companies. I do think it's interesting because both vaccines were made a little bit different, or as in like Pfizer did not take any money from the government on purpose. So to kind of distance themselves from the government. Moderna is a newer company, and they did take money from the government to help develop it. Neither of those is right or wrong, but just so you know, like this is, it's less about the government and more about developing vaccines as quickly as possible, for people. There is, people, Destiny mentioned, this won't be mandated. It's not, we haven't heard any talk of it being mandated, like at state or county levels or anything like that. People don't like to be told what to do. That's another thing that we've heard. And that's great. That's fine. But that's why we want to educate everybody and answer questions so that you can make an informed decision yourself, so that you don't feel uncomfortable with taking a vaccine like this. What else? Anything else in there? There was some stuff going around that said that the COVID vaccine causes infertility. It's just not true. So because what the argument was is that those little spike proteins cause women to miscarry or become or have infertility. Well, if that were the case, then you would have the same effect from COVID because it has those spike proteins, and we are not seeing that anywhere. So just if you hear that, again, we want to present the science behind it, that these things aren't true. There are also no microchips.
That's what I was going to say.
Yes.
Yeah, we've heard that there are microchips in the vaccine. Ironically, I heard the same thing in 2009 with H1N1, but they are in multi-dose vials. So there are 5 or 10 doses in a vial, and you just draw it up in a syringe. Someone might get 6 microchips and someone might not get any at all. That's not
Not real.
No.
I have a great Wi-Fi signal now, though. I mean, from my microchips. Just kidding. But yeah, it's not a thing.
No. For us older people, will we be notified when it becomes available for us? Yes. Yeah. So both hospitals and the health department have signed up to be providers, and I know there are some more providers that will be coming on a little later, or at least they've applied, just within the county. So when changes happen, when vaccine becomes available, it will be in the paper, it'll be on Facebook. We'll do everything we can to make sure that you guys know.
Sheila, you asked, does the vaccine prevent COVID? So that's a really great question, because really, we still don't know if you can potentially get COVID, but the vaccine helps to not help you or not have you get so sick or sick at all. But can you still get COVID and then pass it to somebody? We still don't know, right? So
yeah.
I don't know. Des might have a better answer for that, but
I don't.
Yeah. So that's again why it would be important for everybody to wear masks. The more people we have vaccinated, the less disease we just have in a community, and so that's what we're shooting for there.
Yeah, and I would still as far as vaccine goes, I know that sounds like, well, if it doesn't prevent it, why you do it? There are lots of different vaccines. A lot of them prevent you from getting it. The MMR vaccine prevents you from getting MMR. The flu vaccine doesn't necessarily prevent you from getting the flu, but it generally prevents you from getting a very serious illness and having to go into the hospital. So like Jen said, we're not sure how the flu or the COVID vaccine is going to exactly work, but or you know how it works, but whether it'll prevent it or you can carry it, we're just not sure yet. And the long-term effects of COVID, There are a lot.
Yeah.
Atrial fibrillation, and your heart gets out of rhythm. We've heard of kidney damage, long-term heart damage. I don't know what all, lots of them.
Even just like respiratory, like long-term respiratory issues, coughing, just from the people that let's say I've personally seen in the hospital, it takes a while. I mean, really for people to feel better. And that's even, hoping that they feel completely back to normal. But yeah, a lot of those things, almost every organ, like we're seeing, blood clots and things like that. I mean, almost every organ has had some issues with it in all of our experience so far with COVID, that it's not something to be taken lightly, those long-term side effects.
No, and I would second, we're seeing that here. We talked to a man today who got COVID in November and still can't walk across the room without getting short of breath. And so that is serious lung damage. So those are really serious consequences.
Some people, while you're looking at the question, some people ask, are we going to vaccinate kids? It's studied down to age 16 for Pfizer so far. They aren't they're starting to study younger kids, but we also know that the kids are not transmitting it like we thought, and they're not getting as sick as we thought. And so right now we're focusing on the adults to try to get everyone vaccinated. And also we have limited amounts, so we want to make sure we vaccinate the more vulnerable people.
Yes. And there was a question about free COVID testing in Wilson County. There's not any free COVID testing in Wilson County. You can call your doctor and get an order for a test, and they can bill your insurance. Or you can do a $50 cash and carry. But I'll plug for gogettested.com. And then it's like /Kansas, but it's pretty easy to find. And it will give you locations of free testing sites. There's one in Chanute, there's 2 in Pittsburgh, and there are 2, I think, coming to Montgomery County, at least 1 coming to Montgomery County. So while it's not quite here yet, that's a great resource for people to find free testing sites. gogettested.com.
And just so you know, if you feel like you need to get tested, come ask us. We'll help you out. And odds are good we can probably get you tested here. There are different types of tests too. So we have the antigen test and we have the PCR test. And so the antigen is like the rapid test, like we would do with like a rapid strep or a rapid flu. It's a little less accurate, not much. It's still actually better than what we see for like strep and flu rapid tests. But the more accurate tests are going to be kind of your gold standard is going to be PCR testing. And we have both of those here in Wilson County. So, and we can do send-off tests. We've got a lot of options anyways.
And Jason, the vaccine, I'm assuming you're talking about, will be going to nursing homes first. We talked about it a little bit at the beginning, but they're contracted with Walgreens or CVS? CVS. CMS is Medicaid or Medicare. Yeah. So, Walgreens or CVS, and they'll be taking those to the nursing homes. Candle Rock is I think one step down because they're not that incredibly high risk of a population, but they are group living. So it would definitely be on the priority list a little higher.
Yep. We've had also people say, well, I'm healthy and or COVID isn't that bad, so we're not talking about how bad COVID is today, but we do see that people are dying from it, right? So that's an important thing, that COVID is bad. It's killing, even if it is 1%, it's still 1%. So for a county like ours, that's 90 to 100 extra people that weren't going to die. That's a lot. So, but people who are saying, I'm healthy, I don't need a vaccine, or I've made, COVID's not so bad. If we're to be quite honest, it's less about you being healthy and more about trying to get to that herd immunity where you then, even if you do contract it, what if you pass it on to the person who's not so healthy, right? So maybe you'll do just fine, but the next person that you're around, the person you're visiting, visiting with at the grocery store, or you're seeing over the holidays or something, that person may not be able to tolerate COVID. So please be careful and consider, again, vaccines, much like masks, are about ourselves, but also about the person next to us that we're trying to protect also.
Yeah. And yes, Deb, there is one in Chanute. There's one in Chanute, and there will be one or two coming to Montgomery County, but I'm not quite sure. But yeah, you can even make an appointment to get tested on that Go Get Tested website.
Awesome. I've had somebody ask if you need to get tested before you get the vaccine, and no, you don't have to. You can. We can test anybody, really, at this point. What other questions?
I need to quit looking down. My part is so bad.
Destiny has new sassy hair. It's very nice. We like it.
I should have parted it a little better, though. It's kind of wacky.
See, you got some thumbs ups and hearts, I assume.
They're like, please, go comb your hair.
Yeah, they're like, the part is terrible. What other questions, in case we missed any? Do you want to scroll back up and see? Because I think we caught everything. And again, I do see some doctors on here too. So if there's anything that we might have missed, please chime in also. Like we said at the very beginning, we just want you guys to feel comfortable. We want you to have all your questions answered because we want you to be able to make an educated decision. This truly is our best bet to getting out of this pandemic and getting back to normal life. So we're hopeful that people will consider getting the vaccine as soon as it's available. And like we said, if you have other questions, we're happy to answer them for you too.
Yeah, and I know this one question I think got asked a couple of times, but I want to just reiterate. If you have had COVID and have recovered, you do have a 90-day immunity, and because of the short supply of the vaccine, we do want you to get vaccinated still, but it may be that you wait until the end of your immunity because there's such a short supply, and since you have some immunity already to protect you, then we would want to get that in someone else first, and come back to you when your 90 days is up.
And there's nothing magical about the 90 days, right? It's kind of like, that's what we know in most people, that they have immunity for 90 days. Some people probably have it for more. Maybe some people have it for less. But that's kind of what we're seeing through the research and, studying the antibodies and all that stuff, that 90 days is about right, for about what we're seeing for the average person after they're infected. Mm-hmm. So you still can get COVID. Again, we've had that happen actually here. No,
not
Kansas.
here. In Cherokee County.
Oh, okay.
My friend in Cherokee County said that they had a couple people who had it April and then had it again in the fall. So, yeah. And Barbara, the quarantine length now is 10 days from last exposure. And if you get a PCR test, after day 5, you can get out after day 7, as long as that result is negative and you don't have any symptoms. You just need to wear a mask and monitor yourself for symptoms.
We still recommend 14 days for like the kind of, again, the gold standard of quarantine, because we know that people have developed symptoms from day 2 to day 14 after exposure to COVID. So, if you're able to, 14 days would be the best, but technically, for what we are following the guidelines, you can do 10 days and 7 days, like Destiny said. And we'll hook you up with PCR tests and whatever. It can't be the rapid antigen test to get you out of quarantine early. So we'll help you navigate some of that too.
Yeah.
Okay, last call. Anything else?
I don't think so.
Look, we have a wealth of information. Thanks, Deb. I feel like that's like a plethora of also, thank you. We try, but we just want to make sure that we're giving you all the information we have. And as we get more, we will share that as well. So
yeah. We just want you to be able to make an informed decision.
All right. Okay, you guys, with that, please be careful. We know that during the holidays people want to get together. If you do, please do it only in small groups if you can, and please wear masks. We're not saying no, we're not trying to be super strict or anything. We know that people will probably get together. We'd love, to say, hey, everybody celebrate on your own. We understand how we work, that people want to be together. If you are going to do that, please wear masks. Please try to distance. Maybe a little family can sit at one table and another little family can sit across the room at another table or something. Just be very careful, because we're seeing those small gatherings be reasons for spread. And that's not what we want to see, especially because we're probably gathering with people that we love and we don't want to get them sick. So, so just take care of each other.
Yeah.
All right. Anything else?
No.
Merry Christmas. Happy New Year.
Bye, everybody.
See you next year.